blood work, and nutrition, but I've added red light therapy and sauna therapy to benefit those of Central Illinois. To learn more, click on my banner ad at TaylorvilleDailyNews.com.
Your information station, WTIM.
It is time now for the WTIM Pana Morning Show. I'm your host, Tim Zalabak. Thank you all for tuning in on WTIM, your information station. This Pana Morning Show is brought to you by our title sponsor, People's Bank and Trust, where they put people first. Along with Pizza Man, Noren's Hardware, your Pana Save a Lot, Whiskey Bill, Saloon and Liquor Emporium, the City of Pana, and Locked and Loaded Limited. On the phone line this morning is Laura Cox, Community Liaison for Quad County Home Health and Hospice. How are you this morning, Laura?
I'm pretty good. How are you?
Doing super well. We thank you for joining us today. We're going to get educated on all things Quad County Home Health and Hospice. But before we do, we're going to talk about you a little bit. We got to learn about Laura Cox, our community liaison. How long have you been with Quad County Home Health, and what got you there?
I have worked here about 18 months. I've been in the healthcare field since 2003, and this sounded like a great opportunity for me to help spread awareness for what home health and hospice do.
Just amazing. And yeah, you've been in since 2003. You have I'm guessing you have a great scope of the needs out there and the services that are available now in 2024. So for the people out there that don't know, Quad County Home Health and Hospice, those services offered there, can you give that elevator pitch, get people educated on that?
We go to community meetings. I do spots on the radio. We publish things in newspapers. I'm kind of out in the community a lot. I go to health fairs and just general things that the hospital does. We had a blood drive last week that I was at. So just anything that's community related, I'm out there trying to get our name out there.
Yeah, just getting the message out there, spreading the good word of Quad County Home and Health. So that is amazing. So if you're explaining Quad County Home and Health at all these different events and gatherings you go to, what do you tell people? And I'm sure there's different needs for different people out there, but just the synopsis of it.
I just tell everyone that we are locally owned and operated and have been since 1984 as a part of Pana Community Hospital. So that makes all of our employees, your friends, your neighbors, someone that might be related to you. So we have that hometown touch that some of the other agencies don't have because they might be, headquartered in a larger city or ran by a larger corporation.
Yeah.
And, we're still small. Pana Hospital is still independent. So that makes us, everybody's local choice.
Yeah. It absolutely makes just the patient feel a little bit better on that front. And with the hometown choice and hometown touch, actually, that you said right there, what does that really mean for patients that come into it? Of course, there's going to be providers with more knowledge of the area, but does it have any other positive effects?
I think the biggest positive effect is that we work well with not just Pana Hospital, but all of the local primary care physicians and other local hospitals to make sure that our patients get the best care that they can get. We do individual plans of care in their home so that we know exactly what they need, and we take that information to their primary care physician, and then a plan of care is for exactly what's going to keep them independent. And they know that we're here 24/7, which most agencies are. But, I feel like our staff really works hard to make sure that our patients know that we're here for them, no matter what their question may be. Sometimes it's not necessarily health related. It might just be something that our social worker works with them on, like homebound meals or rides to appointments, things like that.
Sure. Well, let's just get right into that then. What are the differences between receiving that home health care versus hospice care, and then determining that for each individual that comes in?
The difference is home health care is a curative end game. We want to go in the home. We want to help them regain their strength or learn how to take care of their daily activities in a way that's going to keep them in their home. They're still going to be seeing their doctor, going to the emergency room if they need to. Hospice is basically just end of life care. Now, that doesn't mean that it's for 1 day, 1 week, 1 month. It can be as long as 2 years, as long as this person still declines. They've just made the decision that they don't want any more curative treatment in their life.
Yeah. We read a story recently where it said hospice, and it was actually answering some myths about hospice care. And it says hospice is not giving up because that the time of stay can just really vary.
Yes, and that's what everyone thinks. They think you go on hospice to die, but our philosophy is we want you to live while you're dying, and whatever that may be, whether it be, still being able to go outside and mow the yard, or, just being able to breathe easier so that when people come to visit you, that you can, talk for longer periods of time. We just want you to be comfortable and enjoy what you have left.
Yeah. Are there aspects of a day-to-day that come to your mind, common things that happen in people's lives where they need to make that switch over to hospice, where the independence of just living at home is just probably unsafe for them? Is there something that appears time and time again, like on that front?
I think for making the switch from home care to hospice is just that at a certain point, most people just decide that they're tired. They're tired of whatever care they've been getting. They're tired of going to the hospital. They're tired of going to the doctor. And so they just decide that, for me, this is my best option.
Absolutely. Yeah. We got Laura Cox on the line, community liaison for Quad County Home Health and Hospice. And it's a perfect time to have her on because it is Home Health and Hospice Month in November. What does that mean for you, Laura Cox, and of course, Quad County Home Health?
Home Care and Hospice Month is really just a way for us to, get our information out there, remind everybody that these options are available, because some people come home from the hospital either thinking that they don't need home care because maybe they have a caregiver at home, or they don't really understand what home care is. I mean, I myself, I had heard of what occupational therapy is, but until I came to work here, I didn't really understand what occupational therapy does.
Absolutely. And can you explain that real quick for the occupational therapy and just re-educate us on that?
So occupational therapy goes into the home and assists patients with learning how to redo their daily activities. For instance, bathing, cooking, cleaning. Based on what their physical abilities are, they can rework how you get those tasks done.
I see.
In a way that's safe and pain-free for the patient.
Sure. And to kind of wrap up this first segment here, let's describe some of the specific ways. I know independence is so important for people entering this part of their lives, and I'm sure with Quad County Home Health and Hospice, you guys put a lot of attention into that and trying to keep people in their homes. What does home health do to care for those patients, to try to keep them in their homes for as long as possible?
Yeah. So besides occupational therapy, we have physical therapy, we have speech therapy, which actually isn't just about your speech, it's about cognitive abilities and your ability to swallow. We also have home health aides that can come into the home and help a patient bathe until they're strong enough to do it on their own. Plus our social worker, who's there for, not just counseling needs, but just those background needs that a person may want. And our team works together to determine what's going to keep you in your home and keep you independent. They have weekly meetings where everybody's on a call or in person, and they talk about the status of every patient and what we can do to help them get better.
Sure. Yeah. And Laura, you've been in the field and the kind of the medical area since around 2003, and you've kind of seen, I'm sure, different developments proceed and pick up with a new kind of adherence to mental health. Is this something that you guys focus on more as the years have gone on now in 2024? I'm sure mental health has kind of risen as one of those things that keep people in their homes longer or take them out of their homes into hospice care.
Yes, I feel like mental health care, is just a huge thing in all of the medical field, whether it be home care or your primary care physician, your emergency department, and having that licensed clinical social worker, Sam Burton, in our office is really helpful to our patients who might just need a little bit of understanding and someone to kind of hold their hand as they make decisions to make their lives better.
Yeah. And so many services to be aware of, and so many great things happening with Quad County Home Health and Hospice. We're learning from Laura Cox right now, the community liaison. Got to take ourselves a break now on this WTIM Pana Morning Show. It's brought to you by our title sponsor, People's Bank and Trust, where they put people first. Pizza Man, Noren's Hardware, your Pana Save a Lot, Whiskey Bill's Saloon and Liquor Emporium, the City of Pana, and Locked and Loaded Limited. Our live stream sponsors, People's Bank and Trust, and Landmark of Taylorville, where you always do better with Landmark. You can find us on Facebook at Taylorville Daily News and on YouTube at WTIM TV. We'll be right back with Laura Cox on WTIM, your information station.
Your information station, WTIM.
Noren's Hardware is a local family-owned store offering a wide selection of quality hardware supplies at competitive prices. Whether you need plumbing supplies or electrical supplies, you're sure to find what you need at Noren's Hardware Store, including ice melt, shovels, gloves, heat tape, pipe insulation, portable heaters, and propane to get ready for the winter months. Our staff is committed to providing outstanding customer service and is ready to assist you. Visit our store at 55 Main Street in Pana today.
Radio gets results.
Miller Media Group Advertising works for Taylorville Estates. Here's Administrator Tony Clark.
In the past year, we have doubled our census. So that's been impacted mainly by the radio advertising. That is where we do the majority of our advertising. And our census definitely shows that it works. They lead us in the right direction for the season changing, and they anticipate our upcoming needs before we even have to tell them what they are. We've had consistent growth over the past 12 months. Like I said, we've doubled in our census, and that's been the first time in 43 months since prior to COVID that we've gotten to where now we have a waiting list for people to come. So advertising on the radio really does have an impact.
Gets results.
This is Will Perkins with Taylorville Community Credit Union. Are you looking for a great CD rate? If you are, TCCU has a CD special that is just what you are looking for. We are currently offering a 7-month share certificate with an annual percentage yield of 4.51% and a minimum deposit of $1,000. The great rate is for a limited time. For more information, please contact us at any of our convenient locations in Taylorville, Pana, Hillsborough, Litchfield, or online at tccu.org. Dividends will be compounded monthly. A penalty for early withdrawal may be imposed. Fees could reduce earnings on the account member NCUA.
Hi everyone, Nicole Patrick here, your new local country financial representative at 917 West Bresser in Taylorville. I'm proud to recognize the Tornado student athletes that represent our community by being the exclusive sponsor of the WTIM Nicole Patrick Country Financial Player of the Game. During Tornado sports broadcasts this school year, WTIM announcers will select a player at the end of each game who will receive a certificate for being named our Player of the Game. Good luck to all the teams this season, and go Tornadoes!
Pastor Brian Moore here from Locust Grove Church near Assumption. We are alive and so worth the drive. Find directions to our church and watch our video podcasts by clicking our icon at TaylorvilleDailyNews.com.
Agriculture is our largest industry. Your agriculture information station is WTIM, AM, FM, and online. Tune in or stream WTIM's over 8 hours a day of ag information featuring our local farm broadcaster to be in the know.
Your information station, WTIM.
And welcome back into WTIM, your information station in the midst of the WTIM Pana Morning Show with Laura Cox, Community Liaison for Quad County Home Health and Hospice. This WTIM Pana Morning Show is brought to you by our title sponsor, People's Bank and Trust, where they put people first. Along with Pizza Man, Noren's Hardware, your Pana Save a Lot, Whiskey Bill's Saloon and Liquor Emporium, the City of Pana, and Locked and Loaded Limited. Back to Laura Cox here. It is Home Health and Hospice Month this month of November, so I'm so glad to have Laura Cox in with us. We're going to move right along talking hospice care, but also it affects the family members there when you're dealing with a grandparent or a parent entering in to assisted living or hospice care. It takes a toll on a lot of the family there, Laura.
Yeah, it can be very emotionally and physically draining. It kind of really depends on the support serve that you have within your family. My mom herself was on hospice, and I was able to take the time off from work to be there to help my dad and my brother and sister-in-law. And we had cousins, aunts, uncles, lots of people to come and help. But not everyone has that support system in place. your family might not be very large, or they may be aging and unable to help, or you may be, dislocated from them in a different state or a different county or somewhere that they can't travel to easily to help.
Mm-hmm. Absolutely. So how do you guys step in there and just make that a little bit easier?
When you go into hospice care, the goal with the family is to not only give the patient emotional support, but to give the family emotional support. Teach them the things they need to know, like giving the medication, helping the patient if they're not able to get up, how to roll them correctly so they don't get bed sores, how to help them if they get sick, how to recognize symptoms that they may need to contact us over, just general information to make their daily life easier while this transition is happening.
Absolutely. And it's such a multifaceted position, yours and so many people in Quad County Home and Health when you're speaking with the patients and their families, just so many things to be aware of, and whether it is mental health or occupational services. Can you speak to the qualification of your staff members and just ensures that this care is as best as it possibly can be?
All of our staff members are licensed by the state of Illinois. Many of them have been in their fields for a long time, some of them upwards of 20 years. And they bring the best possible care to the patient by working closely with the patient's physicians, whether it be their primary care or specialist, and they create a plan of care with those other medical professionals that addresses the person's needs in their home.
Okay.
And just like the home team, our hospice team also has a weekly meeting with our with all the disciplines to ensure that, maybe we have a patient that we think might be able to have a better course on hospice if maybe they had a little bit of physical therapy. We can send somebody in there to see if maybe there's some strengthening exercises to help them get around their home easier.
Sure. Just a person for any situation that might arise right there, and all licensed, all really great on that front there. For people that might be out there hearing this, for those that care for a loved one there, and they might be hearing this and think this could be an option for them with Quad County Home and Health Services, what would you tell them?
If you think you have a home health need or even a hospice need, they can call our office at Monday through Friday, 8 to 4:30, or even after hours, they can call on the on-call service and speak to a nurse. And we can always take a referral from anyone, whether it be a medical professional or the person themselves. We have people call all the time referring themselves because they've had us before and they just got out of the hospital.
Yeah.
All we have to do then, once we know what you may need, is then we contact your medical professional to get all the documents that are required, like the plan of care and a face-to-face, all the things that insurance has to have for us to see the patient.
Yeah. And when speaking about home health services, moving to hospice care, what do you see usually? Is it a loved one, or someone caring for a loved one there, or is it an elderly person coming to Quad County saying that I'm ready for hospice care?
For the most part, it's the children of an elderly patient. That's not to say that we haven't had, pediatric patients on hospice or, really young people, but it's usually either the parent or the child that call in and say, hey, I think that our best course at this point is to maybe explore hospice.
Yeah.
And we can either send, our social worker or a nurse to meet with them and discuss the program ahead of time and let them know all of the ins and outs and all of the things that they need to know. And we can even leave them like literature about, signs and symptoms of someone, starting to go through the dying process.
Yeah.
So that way they don't have to make a decision right at that moment. They can think it over and always call us back if they want to make that decision.
Just perfect. And Laura, we got about 60 seconds left. If you wanted to work in how Quad County Home and Health has worked so well with local medical as well, like Pana Community Hospital, how are those partnerships helping you guys out?
Those partnerships work well because they know that, we are going to work with them to create plans of care that's meeting the most urgent needs of their patient.
Okay. Amazing. And Laura, since we are pretty much out of time here, where can we go for more information, numbers we can call, websites we can go to?
Our office number is 217-562-6380, or you can go to PenaHospital.com, and Quad County is listed under the services area.
Amazing. Laura, thank you for filling us in today. We learned a whole lot, and just great things you do, especially in November, Home Health Hospice Month. We thank you for joining us today.
Well, thank you for having me.
Absolutely. Laura Cox, Community Liaison on this WTIM Pena Morning Show. She's the Quad County Home Health and Hospice Community Liaison. You've been listening to WTIM, your information station.
The Big 870 WTIM Assumption Taylorville, 96.1 W241 CF Taylorville, 107.5 W298 CD Shelbyville, 107.9 W300 EH Payne Nokomis.
To serve as Secretary of State. After considering Rubio for vice president earlier this year, Trump apparently planned to name the Florida senator as the nation's top diplomat. The two men were rivals back in the 2016 presidential campaign, but have since become allies. Rubio, a member of the Foreign Relations Committee, is known for his hawkish position and for being a tough critic of Russian President Vladimir Putin. Greg Klug